Good day, my name is Sairankyzy. I am an assistant of Department of Propedeutic Children Diseases. Today I will tell you a lecture. The topic of our lecture, Anatomical and Physiological Features, Skeletal System in Children. Bookmark and the formation of bone system occurs later than other systems of the body, in the 5 weeks of fetal development. Final bone structure is formed after birth and occurs in age when the child grows well. Future fetal skeleton in the required areas of the embryo formed from mesenchymal cells of 2 types of osteogenesis: dermal connective tissue and chondral cartilaginous. In a dermal variant bone formation, bone is formed directly from the mesenchyme. Thus formed the bonus of the cranial vault, the lower jaw, face and the diaphysis of collarbone. When a chondral bone formation at the beginning in the mesenchyme formed cartilage, and then of them bone. All the parts of the skeleton and the developing of chondral type bone formation. By the time the baby is born, its diaphysis of long bones consists of bone tissue, and the majority of their epiphyses, bone hands and the feet of cartilaginous tissue. Later in the epiphyses, ossification points appear, which are surrounded by growing cartilaginous tissue. Intense skeletal growth in its constant self-renewal leads to the fact that the bone tissue of the child's first years of life is relatively soft and flexible. Due to violation of nutrition, position of mobility, arise the formation of the baby variety of skeletal deformations. A characteristic feature of age-related skeletal maturation in children is a gradual change in the body proportions. The smaller the child age, the size of his head more than on the overall body size. In the final maturation of the skeleton, the head height increased only 2 times, the length of the body 3 times, the length of the lower extremity 5 times. At birth, the baby's head is about 1/4 of the total body length. In the from 2 to 3 years, 1/5. In from 6 to 7 years, 1/6. In the high school age, 1/7. In adult, 1/8 of the total length of the human body. Skull bones in children. At the newborn, cerebral part of the skull dominates the front part, especially pronounced as preterm infants. In the adult, on the contrary. After the birth of a child, the seams between the skull bones have not yet formed. There is the connective tissue between the bones. So the bones of the skull can shift. That is very important during childbirth. In some places there are significant expansion between the skull bones, the so-called fontanelles, big, small and the lateral. Anterior or big fontanelle. The form of diamond shape, located at the intersection of the coronal and the sagittal sagitts, between the frontal and the parietal bones. Size from 2.5 to 3 centimeters. Class of fontanelle to 12-18 months. Posterior or small fontanelle, triangular form, located between the occipital and the parietal bones, size from 0.5 to 0.7 centimeters, crucial fontanelle to 2 months. Side fontanelles, 2 gaseous fontanelles and the 2 wedge fontanelles. Triangular form, they are located between the occipital parietal temporal bones on the right and the left sides of the skull. Crucial fontanelles from 1 to 2 months. Teeth in children. A child is born without teeth normally. On the first year of life, the baby teeth erupt in pairs with the 6 months in the following order. From 6 to 7 months, 2 lower central incisors. From 8 to 9 months, 2 upper central incisors. From 9 to 10 months, 2 upper lateral incisors. From 11 to 12 months, 2 lower lateral incisors. The order of eruption of primary teeth for second year of life. 12 for 10 months, 4 molars, first lower, then upper. From 10 to 20 months, 2 canines, first the lower, then upper. From 20 to 24 months, 4 second molars, first the lower, then upper. In second years in 2 years, the child must be 20 milk teeth. To determine the number of primary teeth aged from 6 to 24 months with the formula x total n minus 4, where is x number of milk teeth, the n the child age in months. With from 5 to 6 years of permanent teeth begin to erupt. The first large molars appear first molars. So, subsequently, the sequence of eruption of permanent teeth occurs in the same way as the dairy. Appears premolars, small molars in from 9 to 12 years. From 12 to 13 years, the second molars. The latter appear third molars erupt in from 17 to 25 years. In adults, the number of permanent teeth 34. To determine the necessary number of permanent teeth up to 12 years in children, using the formula x total n multiply x total 4 multiply n minus 20, where is x number of permanent teeth and h in years. Spine in children. The spine in the first months of baby's life has no physiological bends. In infancy, it begins a gradual bending of curtailed parts of the spine, forward lordosis and the back kyphosis. The cervical lordosis is formed by from 2 to 3 months of age. Thoracic kyphosis is formed by from 6 to 7 months of life. Start formation lumbar lordosis corresponds to the end of the first year of life. The final formation of the thoracic kyphosis in from 6 to 7 years and the lumbar lordosis school years. Rib cage in children. The edges of the newborn are located almost horizontally. With respect to the spine, form a right angle. The chest is broad, short, anterior, posterior, and transverse dimensions of of the same. The chest has kind of position of maximum inspiration. Gradually, anterior-posterior dimensions compared with the transverse dimension decrease. By puberty, there is an increase of lens thorax. The ribs are lowered relative to the spine, forming an acute angle. From 12 to 13 years, the chest takes the form of the provisions of the maximum exhalation. Thank you for attention.